Welcome back, everyone, to Pathways in Pediatrics. This is the official podcast of the European Academy of Pediatric Societies, EAPS.
Great to be back.
We're continuing our sneak peek series, looking ahead to the EAPS 2025 Congress happening this October in Lisbon and, of course, online.
Yes, and after covering areas like ICU, genetics, oncology, and surgery in our previous episodes, well, now we're diving into a really crucial theme.
Absolutely. Today's focus is on psychiatric, developmental, and behavioral health of children. It's such a rapidly evolving field.
It really is. And you could argue it's one of the most urgent areas in modern pediatrics. It touches on so much development, identity, mental well-being, sleep. It's all interconnected.
Exactly. So our job today really is to try and connect some of the dots between key presentations in this area that you'll be able to see at the Congress. We'll start off by looking at some of the most, dynamic areas in psychiatric health. Let's talk about identity and mental health trajectories first.
Oh yeah, sounds good. Let's unpack this. There's a foundational talk coming from the Netherlands that looks fascinating. We're really looking forward to the presentation by Isabel van der Meulen and Annela de Vries. Their session is called Gender Identity and Gender Dysphoria in Children and Adolescents. Where do we stand in 2025?
Right. And this session is so vital because it tackles a population we're seeing more and more of in clinical settings: transgender and gender diverse youth, TGD youth, seeking care. The speakers are really well placed to give that psychiatric overview, especially given the history there.
That history is key, isn't it? The Netherlands was the real pioneer, setting up those early protocols for gender-affirming care. I mean, hormone treatment back in the early 90s, puberty suppression for minors in the early 2000s.
That's it. The protocols that started in Amsterdam, they basically became what the world knows as the Dutch protocol. Really formative stuff.
Yeah. And what's striking is, even as the clinical pathways have developed, the underlying mental health vulnerability seems, quite stark.
It really does. Research consistently points to higher rates of serious mental health challenges among TGD teens. We're talking depression, anxiety, self-harm, suicidal thoughts, even eating disorders. It tells us we're dealing with a population that's profoundly vulnerable and needs very specialized, informed care.
And here's something that might surprise people, which the authors are going to highlight. You actually see differences in how mental health issues present based on the sex assigned at birth. But maybe even more counterintuitive is that a pretty significant proportion of TGD adolescents also have features of autism spectrum conditions.
That's more than just a coincidence, It raises big questions about diagnostic overlap, the need for really careful differential diagnoses. Now, when you look at the evidence base overall, longitudinal studies generally suggest a positive trend, psychological improvement after getting access to gender-affirming care.
Okay, so if there's a general trend towards improvement, what are the limitations? What are the authors going to focus on there?
Well, the main limitation is the lack of really robust long-term data, especially on the effects of puberty suppression. That's the big gap. So van der Meulen and de Vries, they'll use their presentation to kind of synthesize what we know now about mental health trajectories, detail those co-occurring conditions we mentioned.
Like the autism spectrum feature.
Exactly. And identify specific protective factors, which is crucial for intervention, right?
Yeah.
And then map out where research needs to go next to give us that fully evidence-based care we need.
Right. Okay, moving from identity issues to development, let's talk about sleep. It's such a huge factor in behavioral and developmental health because if you miss a sleep disorder, you might end up thinking the symptoms are purely behavioral issues, right?
Precisely. It's a classic pitfall. So in the session, Sleep and Sleep Disorders in Children, practice points, we're going to hear from Oliviero Bruni from Italy. He'll be addressing the challenging topic of pediatric restless leg syndrome, or RLS.
RLS. We know it in adults, that horrible, irresistible urge to move your legs, worse when you're resting or in the evening. But while it was recognized in adults first, its importance in pediatrics. Ekman pointed it out way back in '75. It's becoming really clear in clinics now.
Yeah, and the real challenge, which Bruni will likely focus on, is actually diagnosing it in kids, because young children, they might struggle to describe that creepy, crawly feeling,
Right.
So clinicians have to rely a lot on detailed histories, objective measures too, like polysomnography, looking for periodic limb movements during sleep PLMS.
Right.
The Congress is definitely going to highlight this urgent need for better diagnostic tools specifically for kids, ones that go beyond the adult criteria.
And the data shows why it's so important. RLS affects maybe 2–4% of children generally, but that number just skyrockets in certain groups, particularly kids presenting with ADHD and autism. That link is really significant.
Oh, it is. Because RLS causes major daytime problems. We're talking about excessive sleepiness that can look just like ADHD symptoms, serious behavioral issues, and then problems at school. If you just treat the ADHD but miss the underlying RLS, well, you're just treating the symptom, not the root cause.
So, if the underlying issues involve genetics, iron deficiency, maybe dopamine problems, what's the management approach going to be that they'll discuss?
Well, it starts with non-pharmacological stuff, optimizing sleep hygiene, looking at diet. But the medication side is tricky. There are no drugs specifically FDA approved for pediatric RLS. So clinicians are kind of forced to use off-label therapies, things like iron supplements, maybe gabapentin, dopamine agonists, clonidone. But all of those need really careful monitoring precisely because they're off-label.
Right, right. Okay, sticking with sleep disorders in vulnerable groups, let's jump to another presentation in that same session. Jessica Teitard from France is giving an important update on obstructive sleep apnea, OSA, but specifically focusing on children with Down syndrome.
Yes, and this is a huge clinical concern. It really deserves this focused attention. OSA is incredibly common in kids with Down syndrome, or DS. The prevalence numbers are just staggering, estimated somewhere between, 66.4% and maybe even 82.6% of this population.
Wow. Compared to what, like 1 to 5% in typically developing kids?
Exactly. It's potentially 60 times higher. The difference is massive.
And a lot of that comes down to the specific anatomical differences in DS, doesn't it? Things like the midface being underdeveloped, a larger tongue, maybe laryngomalacia, structural things.
Precisely. Those create a predisposition.
Yeah.
Then you add in common comorbidities in DS like obesity, hypothyroidism, maybe reflux, and the risk factors just pile up. And the urgency is because untreated OSA actively makes neurocognitive and behavioral problems worse in these children. Even though the signs can be subtle, hard to spot sometimes in this group, timely treatment is just non-negotiable to prevent long-term issues.
And this is where early intervention seems so powerful. Teitard's presentation, it sounds like it will really emphasize that getting an early diagnosis and treatment, ideally before 36 months of age, often with ENT surgery, seems linked to better neurocognitive outcomes.
That's a potentially huge win for development, yes. It certainly is. But what's interesting, and what Teitard will explore, is that even with those good initial results, we still have questions about the long-term picture. Like, what's the risk of OSA coming back after the first treatment? And do those initial neurocognitive and behavioral benefits actually last throughout childhood? Those are key areas.
Yeah, getting that evidence will really shape future guidelines, I imagine.
Without a doubt.
Okay, so all this incredible research we've just talked about, TGD, mental health, RLS, OSA, and Down syndrome, it all relies on one thing, doesn't it?
Yeah.
The data has to reflect the real experiences of the kids and their families, which brings us neatly to a really foundational theme at EAPS 2025, the patient-family perspective session.
Exactly. This is where the science meets, well, the human reality. And we're going to hear from Johan Prevo. He's from IPOPI, the International Patient Organization for Primary Immunodeficiencies. He'll share their deep experience in engaging patients and caregivers, both in research and just in daily clinical practice, specifically around primary immunodeficiencies, or PIDs.
IPOPI has been really active, haven't they? Showing how patient groups can properly integrate into research. They've been involved in big EU-funded projects, making sure the patient voice is there right from the design stage all the way to sharing the results.
Yes. And they'll probably highlight their collaboration within the European Reference Network, ARIDA. Specifically, co-developing the JOPAF patient experience mapping tool. And this isn't just another survey. It's a really systematic way to map the whole patient journey. It captures nuances that standard clinical forms often miss, making the data much richer.
They also do those big global patient surveys, right? Like the one on long-term COVID effects and PID patients. Gathered tons of responses worldwide.
They did. And the fundamental takeaway from IPOPI's approach, the blueprint really, is that meaningful patient engagement gives you richer, more ecologically valid data. It fundamentally makes the research outcomes more relevant because you're treating patients and caregivers as genuine partners. You ensure the questions being asked are the ones that actually matter most to them.
That's such a vital model, especially for other rare disease communities.
Absolutely.
So to round out this theme of engagement, we'll also hear from Charlotte Engelhoff from Sweden. She's going to explore the real practical side of involvement, like what are the actual barriers and what really works the facilitators for engaging the whole family unit, parents, kids, even siblings in pediatric research.
Yeah, this tackles that critical implementation gap.
Mm.
Engelhoff outlines some pretty significant barriers that stop families participating. And it's not just about logistics. We're talking about things like a lack of trust in institutions, worries about risks, cultural or language differences being huge obstacles sometimes.
Then you add the practical stuff on top. Families just not having the time, the emotional burden of constantly revisiting the child's illness for interviews or data collection. Plus, organizational barriers, staff changing in clinics, clinicians maybe not having enough time to properly support research participation. It's systemic.
It is systemic, which is why the facilitators she identifies are so key. They really focus on building genuine mutual respect, treating parents like real partners in the research, not just subjects, and also recognizing that often the main motivation for families is altruism, that powerful desire to help other children in the future.
Right. And practically speaking, successful recruitment often means using trusted networks like parent organizations, making sure outreach is culturally sensitive, and being flexible, offering remote options, easy to understand materials. That's crucial for families managing complex health situations.
Exactly. Angel Haas' presentation won't just be theoretical, it's going to offer concrete, actionable recommendations. Real advice on improving communication about research benefits and specific ways to tackle those persistent organizational hurdles in healthcare systems.
Wow, that really does tie it all together. We went from the intricacies of TGD, psychiatric needs, and the diagnostic challenges of RLS and OSA and developmental disorder, all the way to this essential foundation, the patient and family voice that has to underpin all pediatric science. It really shows how interconnected these challenges are, and why a multidisciplinary congress like EAPS is so valuable for bringing different perspectives together.
We really hope you can join us for these discussions and many more at the EAPS 2025 Congress. It's happening from the 18th to the 20th of October.
You can be there in person in beautiful Lisbon, Portugal, or join virtually from anywhere via the online platform. All the details are on the EAPS website.
And maybe a final thought to leave you with, tying together that crucial role of families we just discussed. If we accept that the IPOPI model shows meaningful family engagement is the gold standard for research, how do we then move beyond just hoping for altruism? How can we systematically break down those persistent clinical and organizational barriers to truly embed that family-first approach across all these critical areas of developmental and behavioral health?
Something to ponder. We look forward to exploring these questions further in Lisbon.
We certainly do. Hope to see you there.
Until then, take care.